When we talk about the future of healthcare, we know it rests in the students today, who will become the healthcare workers of tomorrow. With so much movement in the health landscape and knowledge about best care practices, we wanted to know how it's being translated in the classroom. Mutually Inclusive got to sit down with staff from Grand Valley State University's Kirkoff College of Nursing to learn more.
Fingerprints are everywhere. Small impressions, each unique and personalized. They can be used to identify you in an emergency, or just get into your iPhone. But for Dr. J. Knight, fingerprints hold a special purpose, telling a story of their healthcare journey.
So before I was a teacher, I would touch on a given shift maybe 8 to 12 patients, right, in the emergency department. Now that I'm a teacher, my fingerprints are on all of these other students in the way that they deliver care to their patients. So if we think about that as it relates to delivering affirming care, but also as it relates to closing gaps in knowledge and addressing stigmas, we see those fingerprints, and it starts in the classroom.
Knight has around 20 years of experience in healthcare, during which time they attained a doctorate of nursing practice with the goal of being able to teach. They landed at Grand Valley State University's Kirkoff College of Nursing, educating tomorrow's health workers as an assistant professor.
I'm excited to be a part of this work and to not only be able to lean into my passions as far as addressing health disparities and giving back to the profession of nursing, but also leaning into helping the next generation of nurses. And it's a good spot to be in.
While certain principal practices may be the same, Knight says today's training is different than what they experienced as a student. It's more expansive when it comes to patient identity and affirming care, specifically as it relates to the LGBTQ+ community.
Thinking about my education journey in nursing, I had to go hunting for the LGBTQ stuff. I put it upon myself to go learn the things because I was part of that community. I knew as I gained more clinical experience, I knew, okay, this is impacting all of these things downstream. And we look at the last 5-ish years, we're seeing societal demands and patient experience. They are seeking that and expecting that from their care team, and rightly so. So then that bleeds over into our students demanding and expecting that expertise and that level of comfort, which then feeds into the faculty need to have that.
Over the last few years, there have been achievements in LGBTQ+ care, but historically, healthcare for this population has been suppressed, which leads to gaps in knowledge around affirming, trauma-responsive, and culturally responsive practices. Knight says their team wants to jump forward.
For instance, I see here at KCON, we have a group of nursing faculty working on research specifically related around addressing LGBTQ education gaps in the classroom. So that's one area where our own faculty are doing research and seeking to understand and close those knowledge gaps.
Students within the Kirkoff College of Nursing have state-of-the-art technology at their fingertips inside its interprofessional health simulator, helping learners get hands-on experience administering care.
You think about the learning environment is an opportunity to make mistakes and to practice. I mean, we have simulation labs all over the place, and certainly sometimes they look like a hospital setting, and other times it's a simulation and it's a critical conversation with a patient and it's practicing language.
There's a large focus on communication with patients, but it's not all bedside manner. In addition to creating a trusted environment, Knight explains the importance of understanding the layers to different patients' needs.
For instance, somebody who is gender diverse, so let's say that they are a transgender male, they still have the capacity to get pregnant, have ovaries, uterus, etc. What are we doing to make sure we don't misstep? We think about clinical decision support tools. These are little pop-ups that remind you or clue you in as a care team member, hey, we need to be on the lookout for fill in the blank. For instance, pregnancy, perhaps. We need to get a pregnancy test for this patient. Sometimes those rules, if you go upstream, are built on legal sex, which might not be appropriate.
It's widely understood that this kind of personalized healthcare is particularly important when serving patients who have overlapping, underrepresented identities, such as queer communities of color, populations which have been adversely impacted by prejudice. But what about healthcare workers who also belong to these communities?
That minority stress and kind of describing how that contributes to burnout. And we think about, especially right now with COVID and staffing demands, burnout in healthcare is huge, right? The number of nurses that are leaving the profession after the first year is skyrocketing right now.
Healthcare, like many industries, is seeking diverse talent to bring a multitude of understanding, viewpoints, and ideas to the table. And in the wake of nursing shortages, coupled with tense political climates, Knight wants to ensure these essential workers are supported.
One thing I don't think we are doing an adequate job of is ensuring that those that are in the field doing the work, for instance, if they identify as part of the Black and Brown community and part of the LGBTQ community, all of those various identities that folks bring with them, they come with a price as it relates to stigma and potentially bias. If we add in the static as it relates to not being able to be 100% authentic, having to potentially, if their patient asks, so what's your husband like? Well, I don't have a husband, I have a wife. Or what do you mean your pronouns are they, them? And having to correct, having the loneliness of onlyness, that adds weight to each and every shift.
Knight says with multifaceted problems come multifaceted solutions, and while nothing may change overnight, there are tools at play promoting equitable care.
Many of the health systems have the ability to collect sexual orientation and gender identity information and then act on it. So within their electronic health records where they're collecting all kinds of information about you, well, now they have the ability to collect your gender identity, potentially the sex you were assigned at birth, also taking a look at what organs you may have, and using that information then to drive clinical decision making on if that pregnancy test alert comes up or not, as opposed to just relying on your legal sex, which may or may not be in step.
As for the future, Knight knows their fingerprints will multiply every day, sending a chain reaction of inclusivity they hope will carry forward.
I'd like to see it become more regularized, demonstrating the skill in a variety of ways, and that being the norm as opposed to exceptional. So like we think about our virtual meetings and you've got your name on there, do you also have your pronouns displayed, including your pronouns in your email signature line? This isn't just for the LGBTQ community. It's for instance, the Jamies and the Chris's out there that maybe have gender neutral names, and now you're setting others up for success to address them in a way that they feel safest. I would like to see more intentionality to help build resilience across the board, recognize them and empower their authenticity so that they're not having to devote energy to covering and turning down the volume.